Okay, good afternoon, everybody. Welcome to this UKFPO webinar, one of a series of webinars that we've been running monthly of issues that are hopefully useful to foundation doctors and those training them alike. This afternoon, we're going to look at the annual review of competency progression, the ARCP, which is something all trainees have to undergo once a year, an annual appraisal, if you like, a review of their training progress. And in the context of foundation, these are almost all done in June, and they relate to either completing the F1 year and moving on to F2, or completing the programme and moving out into specialty training or other areas of practice. All the ARCPs, as I say, are usually done in June. The reason for this is that they have to be completed by the end of June for F1s to have their registration processed by the GMC in July, ready to start for F2s, ready to start as F2s in August. The F2s are usually done towards the end of June after the F1s have been completed, which means that essentially portfolios need to be completed by the end of May. I have with me this afternoon Fiona Cameron, Foundation School Director from Scotland, and Aisha Najmuddin, who's one of our UKFPO Fellows. Fiona's going to give the trainer a view of all this, and Aisha is going to give the what I suspect will be more useful to many of you, is going to give the trainees approach to it of how you can get your portfolio ready for ARCP so that you fly through it with no difficulties. So we will be running a QA session at the end. If you want any questions answered, please put them in the chat. We may try and answer one or two as we go through. If not, we'll try and cover everything at the end. So please do use the QA function. And if you do find this useful, please share it with your colleagues. We'll be up on the UKFPO website, hopefully within a few weeks. So without further ado, I'll hand you over to Fiona.
Thank you very much, Tony. I'm going to start sharing my slides, I hope. Okay, so can I just check that, can somebody say yes if they can see those?
Yes.
Yeah, thank you. Okay, so my name is Fiona Cameron. I'm one of the Associate Postgraduate Deans and Foundation School Director in Scotland. And I'm also Chair of the Academy Foundation Committee, and I have a fair bit to do with the curriculum. So happy to answer any questions as we go forward. So the end of your training year, you have your annual review of competence progression, known as the ARCP. Every doctor in training has one of these, and you have one annually. Now, it's something that nearly all of you will smoothly progress through with absolutely no problems. But you absolutely have to prepare for it, and you have to give yourself plenty time to prepare for it, because it does take a good few hours to get yourself ready for your ARCP. So, as I said, all doctors in training have an annual review of their progress. It is annual, i.e. within the 12-month period. However, if you are out of sync, such as if you have been working less than full time, or you've had a period of absence, no matter for whatever reason, then it might not be within the 12 months, it might be slightly longer than that, but you will have it within a sort of 15-month period. You will be informed as to exactly when your ARCP will happen. You'll be informed what your deadline date for submission of your information is, and you will get this information well in advance of your ARCP. In fact, you should probably have had information from your deanery or your foundation school early on this year, just to let you know when your ARCP will be, and you will get subsequent emails with more details. It is usually a desktop exercise, and you probably will not be invited to attend. However, I know that some foundation schools do invite their foundation doctors to attend. What happens during your ARCP? Your portfolio will be reviewed in detail by trained education supervisors and/or foundation training programme directors, and potentially the foundation school director. They will look at the evidence that you have provided to support your satisfactory sign-off. They will look at the content, the numbers of pieces of evidence that you've put in. They will look at your feedback, and they will look to see that you have actually mapped to the curriculum. This is important because the GMC give us standard outcomes. They're labelled, they're given numbers, so 1 to 8, and you don't need to worry about all the numbers. There are a few that are relevant for a foundation, but not all. And your trainers have to assess your portfolio against the curriculum, and they will then give you a standard outcome. As Dr. Chosa said, it is usually in June, but occasionally they might sneak into early July, particularly for F2s, but June is the standard time for our ARCPs to happen. You will be informed of the submission deadline, and that is a deadline. If you don't submit in time, then you will get a slightly different outcome, which is not a satisfactory outcome and is a holding outcome until all your information is in. So it's not a suggested submission deadline, it is an absolute submission deadline. Now, this is an incredibly busy slide, and I'm not going to read through it all. This is taken from the UKFPO website. And if you look at the curriculum page, this is what you will see when you see ARCP requirements. I'm going to go through these in a bit more detail with you, and I know that Aisha is going to give you some guidance on how to get all this information into your portfolio in a realistic way. This is far too busy for me to talk through, but when you go onto the website, this is the page that you will see. So let's break that down a little bit further and make it easier to digest. You know that at the end of each post that you do, your 4-month post, you have a clinical supervisor report, and that you have an educational supervisor report at the end of the year. In order to complete your ARCP satisfactorily, you should have 3 satisfactory clinical supervisors reports, educational reports, and 1 satisfactory end of year report. Scotland runs things slightly differently in that we have slightly different educational supervisor arrangements. So in Scotland, we have instead of an educational supervisor end of year report, we have a satisfactory foundation programme director end of year report. And that is in lieu of the educational supervisor end of year report. Content is identical, it's the name that is slightly different. So you have to have satisfactory reports. It is possible that one of your reports may not be satisfactory. This may result in you having to have further training, but it is also your supervisor at the ARCP will decide whether your other reports are satisfactory and that they are prepared to accept one unsatisfactory report. That is very much at the discretion of your ARCP panel, and obviously the content and the reasons for it being unsatisfactory will affect their decision. And I don't want to go any further detail, but essentially you want to have these reports as satisfactory. The other things that you will require is that you will need to have supervised learning events. There is no minimum number, there is no maximum number. What we suggest is that you have enough to cover the curriculum. And you need to look at the foundation professional capabilities and decide, have you got enough content in there to evidence all the FPCs? It's unlikely that small numbers, something in single figures, will be enough. It is very likely that you will need double figures in order to satisfy the curriculum outcomes. You must have a tab, a team assessment of behaviour that is satisfactory, and you should have a satisfactory placement supervision group report, that's PSG. It is possible that if there are developmental content within that PSG, that your supervisor may accept this as satisfactory, but again, that is the panel's decision. So there may well be things that you have in there that shows that you need to keep learning, but if you have kept learning and show that you've progressed, then your supervisor may accept this as satisfactory. Again, this is all something that is discussed and agreed at the ARCP. Really important is to attend your teaching, and this is essential that you attend 30 hours of your core learning. The core learning is the learning that is delivered to you by either your deanery, your foundation school, or your trust, and that is your core learning. You must then have another 30 hours of non-core and a total of 60 hours. You can, of course, have more than 30 hours of core, in which case you can drop the number of non-core hours accordingly, as long as there is a total of 60 hours of learning there. Some of this can be from e-learning, some of this can be from webinars, etc., that you've watched, but you must log these on your portfolio. You must have evidence that you've taught others. You can use the Developing the Clinical Teacher form, or you can use the Learn form or any other of the SLE forms to demonstrate that you are a doctor who teaches other members of the multidisciplinary team. Reflections are required. Again, no minimum numbers, but you need to reflect on your practice. And in fact, the summary narrative, of which you should have 3 by the end of the year, 1 for each higher level outcome, which is really a reflection on your progress, your developmental needs, and also where you think you have shone, where you think you have done really well. Put that in your summary narrative. Another thing that you require is your Form R or your SOAR declaration. This is about probity, and this is something that the GMC expect. As an F1, you will have to do a Form R in England, I understand, but you, as an F1, you don't have to complete a SOAR declaration in F1. That is for F2s. Again, your deanery will inform you of how to access your Form R and your SOAR declaration, and that must be completed. If you're an F1, then you must have passed the prescribing safety assessment. Many of you will have that completed and passed as an undergraduate, but if not, you must have completed it by the end of F1. It is not an F2 ARCP requirement, although you may have been asked to complete this by your foundation school, but for F1, it is an ARCP requirement. I understand that this may seem quite a lot of evidence to generate, which is why if you haven't started putting things in your portfolio, you must get on doing it now. And have a look now. Have you actually met the requirements? How far on track are you? Try and get it done as soon as possible so that you don't leave it to the last minute. Now, we've talked about the HLOs. These are the higher level outcomes, and they're broken down into 13 foundation professional capabilities. I'm not going to read them all out to you. They're all there for you to see. And it's important that you link to these FPCs, and you probably want about 5 pieces of evidence for each FPC so that you can complete the portfolio. Now, as I said, how do you do it? Start working for your ARCP now, okay? We're almost into April, and the end of May is really not very far away. So look at these FPCs that I've shown you. Do you have the evidence? Have you linked them? What can you use? Do you have the curriculum coverage? Do you have enough evidence of physical health, social health, mental health? And do you have a complete set of tabs? Do you have the right numbers? Do you have the right mix of assessors? And where are you with the PSG? Has it been completed? Do you have a minimum of 1 response? And ideally you have more. Your summary narratives are editable. So have a look at it. You might have written something in maybe December, January time, and now you go back and look at it and say, actually, this is not what I want to write. I want to edit it. And remember your teaching hours. What you don't want to be doing is in the week before your ARCP that you have something like 20 hours of modules to complete. Please don't leave yourself in that position. Try and make sure that you're proactive and you get your teaching in now, because the last thing we want to do is have you landed with a lot of work to do towards the ARCP time. Have you reflected enough? And have you got some teaching that you can show? And do you have feedback on that? Because that's where you really learn. So there are some common questions that we get asked. We get asked these every year. And one of the comments, and I'm sure Aisha is going to pick up on some of this, is how many SLEs do I need? People ask this all the time. There is no minimum number, but you must ensure that you have everything covered within the curriculum. FPCs 1 to 5 will be where the bulk of your SLEs are placed, but you may want to put some links to the other FPCs, and please make sure that you have physical, mental and social health evidence within your portfolio. As I said at ARCP, your supervisors will be reading the evidence that you have submitted to make sure that the quality is there. Now, FPC2, clinical prioritisation, must be evidenced by simulation. Now, in F1, this might be ILS. In F2, it may be ALS. Your school may provide alternative simulation events to cover this, but they have to be demonstrated by simulation. You can't just pop in an SLE to say that you attended an unwell patient. You must do this through simulation. Now, just a quick word about the summary narrative. People always ask a question about the summary narrative. It is a form of reflection. It is a useful tool at the end of your training year to look at your portfolio. Where am I in my training? Take stock. Have I evidenced HLO1, HLO2 and HLO3? Where am I? Do I have evidence? How am I progressing? And have I met the standards? And then you maybe want to say to your supervisor in your HLO, I believe I have met the requirements for HLO1 as a capable, compassionate doctor. I have completed SLEs, I have reflected on them, I have shown my learning and I've attended teaching. That's the sort of thing that you would be writing with a little bit more detailed in there to show what you have done. So that's what you need to do for your summary narratives. We're not looking at the quality of your English, we're not looking at the quality of your punctuation or your grammar. It is about the content of what you have done. So, as I said, the GMC have standard outcomes for us. For the purposes of foundation, you can have a 1, a 3, a 4, a 5 or a 6. Outcome 2 is not relevant for foundation. What you want in F1 is an outcome 1. And what you want in F2 is an outcome 6. An outcome 5 means that you haven't given enough evidence or you haven't submitted it on time. That can be converted to an outcome 1 or 6 as soon as you complete what is required. An outcome 3 may mean that you need further training and you'll get an extension, and it is very unlikely that you'll get an outcome 4. And that is going to be something that is a long period of time with sorts of lots of extensions. Okay, so these are what the outcomes are. Outcome 4, don't worry about that. It's something not for you to worry about at this stage. And that's all my questions. That's all my talk.
Hi everyone, I'm just going to share my slides with you. So my name's Aisha, I'm an F2 in Manchester, and I'm also one of the UKFPO fellows. Can everyone see that, hopefully? Yes. Fab. So I'll make it bigger there. So I am hopefully not going to repeat too much of what Fiona's gone over, but I'm just going to kind of go through what it's like to kind of go through ARCP and prepare for it from the perspective of a foundation doctor. because obviously I went through it last year and I'm currently preparing again now. So preparing for ARCP, as it was said earlier, start now, because your portfolio is likely going to lock around the end of May. So you've only got 2 months. 2 months sounds like a lot of time, but if there's evidence and certain things that you need to be doing, or you may need some additional evidence, such as letters from consultants and things, people will need time to get those sorts of things done. And we're just about to change over as well for those of us that are kind of in sync. So we need to be thinking about, what do you need from your next placement? Identify that early on. So when you have your induction meeting and things with your next supervisor, those things can be identified early. In terms of linked evidence, so there's a few different things. So you have obviously your curriculum linkage from your SLEs, but there's also additional things that you may need to kind of back some of those things up. So Fiona mentioned teaching feedback for your developing the clinical teacher form. There's a few other things that might be required. So say if you've done an audit, you may need a letter of confirmation from your consultant about your involvement in that. If you've had some involvement in research, say, for example, you can again have a letter from a supervisor or a report or publication or poster, whatever it is that you've done from that. And the reason this is important is for two things. Number one, it shows that you've had an output from these things, but also it's good practice to get into the habit of this, because when you apply for specialty training, quite a few of the programs will ask you for evidence of these activities as well. So it's good that you've got them there and they're ready to go when you need them. So as I said, working with your supervisor to ensure your learning needs are met. So that may be your CS for your next block, but also your ES if there's slightly wider issues, such as say things with like core learning. And I think I remember sort of around this time last year, I realised that there were a couple of the HLOs that I was like, oh, I've not managed to really get any evidence for those. So when I started my third placement, which was in renal, I sort of said to my supervisor that, I needed to make sure that I'd done X, Y, and Z. And she said, yeah, that's great. You're mostly going to be on this ward with this reg. So let them know and I'll tell them too. And it got done and it was obviously fine. So, but like I said, you need to be able to identify what those things are now and not be leaving them too late, because 2 months isn't that long if there are certain things that you can't catch up with via e-learning and that they need to be within the clinical environment. I've put check local standards here. So I'm aware that there's some foundation schools have their own, what they call ARCP requirements. We've discussed that these should be called standards, not necessarily requirements, because they are superfluous to the UKFPO requirements. So, for example, in my trust, there's a few additional things, such as the amount of evidence that has to be linked for, say, like mental health assessment, and certain bits of evidence that you need for, say, your audit and things. And I'm aware that other places have things such as they have to have attended so many clinic sessions. So make sure that if your own trust has its own guidance, that you've read it, and that you don't fall into the hole that I did last year, which I'm going to talk about in a second. So just thinking about what happens next. So as I said, around the 30th of May, early June, your portfolio will lock. So that's the deadline. Everything has to be uploaded and signed off before that deadline. And you won't be able to make any changes to it after that. Your portfolio, so all of your evidence, your SLEs, your summary narratives and everything are then going to be reviewed by the ARCP panel. So I wasn't invited to mine. I don't know of any of my friends or colleagues around the country that were actually. And so I think most of the time the panel reviews them and then we get notified of our outcome via email. So just thinking about what happens next if things haven't quite gone to plan. So this is the same as Fiona's previous slide, which shows you the outcomes. So ideally, if you're in F1, as we said, you want an outcome 1, and if you're in F2, you want an outcome 6. There may be this outcome 5 that you get. So, I don't know why outcome 1's turned red as well. So incomplete evidence. So this happened to me. And I wasn't expecting it. I'd spent quite a long time linking all the evidence, making sure that I had enough bits and pieces. But what had happened was, so going back to what I said earlier, is it's incomplete evidence. So I hadn't read my local requirements / standards enough, and I was basically just missing a letter about what I'd done for an audit from my portfolio. I'd uploaded the presentation, but hadn't actually gotten the sort of additional thing that they wanted, which was something from a consultant to say I did X, Y, Z. So as we said, it means incomplete evidence. So that evidence could be anything. You know, it could be that you haven't linked enough things to certain HLOs. You may be missing something specific that they need. You may not have enough core learning, for example, but they will give you clear directions as to what this missing evidence was. Mine was very much, here's your outcome, this is what we need from you. And then you have 2 weeks to get that evidence and to resubmit it. And in that time, they will open up your portfolio again, so you can readjust that. Because I'd already submitted my, the audit form, so I just made a new one and then added the additional evidence. So it was clear as well that it was the new one that was updated. And yeah, as I said, you've got 2 weeks to resubmit that. So I've just some take-home points, really. I know this was quite short and sweet. I thought it was probably going to be more useful to kind of discuss with you all and see about your questions. The main take-home point is really to be organised and do things as you go along. We're quite late on in the year, but as we said, if you haven't been adding things as you go along, now is the time to really get on that, identify what you need, how you're going to do it, and ways to get it done. And if you identify those gaps now, it'll be much easier in your next block to hopefully be able to get that all done and dusted before the ARCP deadline. Read the UKFPO and the local guidelines carefully. So, there is Gold Guide online, which it's very long, but where the HLO and the curriculum outcomes are, it's quite clear there what is needed evidence-wise for you to link to show that you have met that outcome. And as I said, your trust may have additional local standards that they want you to meet. So make sure you're aware of those as well, and that all of that has been uploaded in evidence. And yeah, have it all ready well in advance of the 30th of May. You don't want to be messing around the night before, because otherwise, you almost will definitely end up with an outcome 5. And even though at the time I thought, oh, okay, fine, it's just one letter that I need, it is stressful. It's not nice thinking, you expect that you've spent time on this thing and it's done and dusted, and then being asked to do something else. So, but as we said, the evidence that you may require, if you do get an outcome 5, it will be clear what they want from you as well. And yeah, don't panic. It's, a fairly straightforward process. As we said, we don't attend the panels, and I didn't need to discuss anything with anyone. It was just a simple uploading of evidence. And the other thing as well that I will say is the forms that you need signed. So your end of placement forms, with either your AS or your FPD if you're in Scotland, and your CS, they will need to be done before that deadline as well. So make sure, again, it sounds a little bit silly, but sometimes depending on, in certain placements, your clinical supervisor may not be easily attainable. So make sure that you basically at your beginning meeting organise one for the end as well, so it's done well in advance of that deadline, and so all of those mandatory forms are done. And that's all I have to talk about.
Brilliant. Thank you very much, Aisha. That was a very helpful review, and thank you, Fiona, for going through things. There's been some really interesting questions in the chat, and we will try and work our way through them now. Please do continue uploading questions if you have any that arise as we go along. I'll start with a couple of sort of statutory type things. The question about strikes has come up, and that's not too unexpected. The rules around this, or the rules around time in foundation, are that at the moment they are essentially sort of time served programs. You have to provide competencies as well. For F1s, there's a very clear rule from the GMC that you have to spend a year as a pre-registration doctor to obtain full registration, and the sort of flexibility within that is that we say, well, if you've only had 20 days out for statutory reasons, and that's leave, sick leave and so on, then that shouldn't cause a problem. The guidance is when you go beyond 20 days, then your portfolio would be reviewed. What's been agreed is that if you are striking, that time is counted as statutory leave and therefore will come within the 20 days allowance. So if you don't cross it, not a problem at all. If you have crossed the 20 days allowance, then your portfolio will be reviewed to see if you've achieved all the other capabilities. Now, in F2, we have a degree of flexibility and discretion, and quite likely if you're doing otherwise very well and you get to 22 or 23 days or even 24 days or maybe even beyond that, we're very likely to say, yeah, that's absolutely fine, assuming you've completed all the other requirements. If you're an F1, then we do have a very clear GMC ruling around this. Now, if you're on a program where you're doing on-call shifts and so on, it's likely that you will have done more than the sort of standard days of training. So that would probably be acceptable, assuming everything in your portfolio is fine. If not, then it is possible that you might be asked to make up a couple of shifts subsequently. And I know some areas do this by delaying the start of F2 slightly and allowing you to work a couple of shifts to go through that. I'm not sure it achieves very much, but it does allow us, as I say, there are very clear rules around this. So please just keep an eye on the numbers, really. But as I say, striking is counted for the moment within your statutory leave requirements and so on. So as long as you stay within your 20 days, sorry, I said leave, didn't I? I meant sick leave and other leaves. Your annual leave doesn't count towards it at all. It's the other leaves that are important. So please just keep an eye on this. But that deals with the striking one. Fiona, there was a question about evidence. I don't know if you could sort of just clarify that a little bit in your role. It's about how many might be required and the types of evidence. Do we need an SLE for everything? How many reflections do we need? What are they supposed to cover? Perhaps you could talk around that one, and then perhaps I'll ask you a question specifically about FPC2, which has come up a few times in ALS.
Yeah, absolutely. Yes, we get asked this question a lot, and it is quite difficult because we don't give you specific numbers. For HLO1, which is the accountable, compassionate and capable doctor, there are 5 professional capabilities. This is where we'd expect the bulk of your SLEs to link to. Now, how many do you need? We anticipate that you'll have about 5 pieces of evidence for FPCs, particularly those 1 to 5. And you can go up to 10 if you want, but we don't want too much. It is because you can't link 1 piece of evidence to every to every FPC, we do expect you somewhere in the region of between about 12 to 15, 16, 17, 18 or so SLEs, because you can't manage to complete the links without a reasonable number. Now, I'm not going to say to you, you must do 15, you must do 13, you must do 18, you must do enough. What I would say is the more you do, the more likely you are to provide good quality evidence for each of the FPCs. We want to see SLEs. Let's think about HLO 1 to 5, one just now, which is FPCs 1 to 5. That's really the clinical part of your job. So you're looking at SLEs. You want to underpin that with some learning that you have done and maybe some simulation and some reflections. So we don't just want all SLEs. We want maybe you have been to a teaching session. Maybe you have done an e-learning module. So put that in. So I'm not going to give you a specific number, but we want you to do enough. And I know that is not the answer you want to hear. You want a number from me, but I can't give you a number. It just needs to be adequate. We know from previous cohorts of trainees, they are all putting in somewhere between 12 and 18 SLEs. but that is not an absolute. That is historically what has been happening. For HLO2, which is the doctor as a professional, a member of the healthcare team, then you're looking at linking your tabs, your feedback, but you don't need SLEs for all of that. You might want to put an SLE in. And for HLO3, a doctor as a professional, that is predominantly your learning, your careers, your taster forms. That's what you want to put in there. Anything you've done with quality improvement, ethics, but you don't need SLEs for every single piece. But certainly for FPC 1 to 5, that's where the bulk of your SLEs are. Question on reflections, again, no minimum number, but the more you reflect, the better quality your portfolio will be. Reflection is an amazing form of learning. You look at what you've done and you see, where are my gaps? What have I done? What did I learn? And what do I still need to do? It's actually very powerful. So if you haven't really reflected in your portfolio, even if you have a couple of pieces of evidence, your supervisor might say, I think you need a little bit more reflection on what you've done. Again, the more you reflect, the better, but don't overburden yourself. Don't put 10, 15 pieces of reflection in. A handful of reflections. It's really driven by you. It's your portfolio. You need to show what you're doing. I hope that answers those questions. I know it's not specific, but it's not a specific science, this.
Thank you. And could you just sort of specify a little bit about providing evidence for FPC2?
Yeah.
I think I should say that very often foundation doctors do ILS and ALS, and essentially the standards of F1 are what's required of ILS. The standards of F2 are roughly what's required for ALS. So if you've done those courses, you're probably 70 or 80% towards getting your FPC2 signed off. But we do require some evidence from the workplace. Perhaps you'd just comment on that one specifically.
Yes, that's difficult. So some people do ALS and ILS as undergraduates. The competencies at F1 are demonstrates the immediate life support, so demonstrates deteriorating patient, at ILS, immediate life support standards. Now, you need to provide this through simulation, and many of you will have simulation events, part of your induction perhaps, a part of your teaching, where you'd practice your A to E assessments, and that's what we're looking for, A to E assessment and how you would initially manage a deteriorating patient. Many of your schools will offer you an ILS course, and you need to do it within the training year. If you haven't, then you should have some simulation within that. So we want to see that. In F2, we want to see more advanced life support competencies. Many of you will be sent on an ALS course run by the Resus Council, or in your departments, but the Resus Council materials, that obviously counts. If you've done it as an undergraduate, you should still demonstrate, and the word is demonstrate, not put an SLE in, but show that you have actually shown that you can do advanced life support competencies. So that's obviously some airway management, some CPR, and perhaps some defibrillation, so that you understand the algorithms, and it should be done through demonstration. Either through an ALS course or your own school will have a way that you can demonstrate that. Putting in e-learning is not adequate. Putting in a mini KEX where you watched a cardiac arrest, that's not adequate. You have to show that you can do that. And the safe place to do it is through the simulated environment.
Thanks, Fiona. I'll just reiterate on the striking. If you strike, that day will count as part of your 20 days out. I would hope that nobody will fail because they strike. As I say, there is a requirement to serve a certain amount of time at F1. And if you go over 20 days, it is likely you will be asked to make up time. It's very unlikely that that would happen if you are in F2. But yes, you do need to declare it on your Form R, or whatever the equivalent is. There's been a question about teaching, a number of hours and cancellation of teaching sessions. If your teaching sessions are being cancelled, they should be reprovided. If they're not, you need to speak to your training program director about this. I think it would be very unlikely. In fact, I've never heard of a case of a doctor failing purely because they didn't get quite enough core hours. we would expect a foundation doctor to get 60 hours of learning of some description. And I think if you find that you're slightly short of core hours, then you should probably be putting that down in your summary narrative to say, I couldn't quite get to teaching because there were a number of sessions cancelled due to winter pressures. I have made up the time by doing some training in those appropriate areas in my non-core learning, and I think any ARCP panel would let you through on that one. But I think some clear evidence of why. There's a little question about who's on the ARCP panel. It's usually made up of 3 people. 2 of them are clinicians, one of whom's usually a sort of senior educator, and an admin person. The admin person often sort of just reviews things to make sure everything's filled in. The job of the clinicians is usually to review the content and just make sure it is up to date and appropriate. And what happens in many panels, as Fiona said, you don't, or as Anisha said, you don't particularly go to them. We expect most people to pass. If there's a possibility you might not pass, it's quite likely your educational supervisor may have said something to you by now, and certainly will have said something to you by the beginning of May that they have some concerns, in which case it'll be thoroughly reviewed and may be reviewed by more than that panel. So moving on. Oh, there was one about the core procedures, Fiona. I don't know if you want to comment on that, the specific GMC requirements, and the fact we don't ask everybody to demonstrate them clearly. Perhaps you'd like to just comment on that.
Yeah, so in your portfolio as an F1, you will see a form that says core procedures. There are 15 of those. I can't remember all of them in detail: urinary catheterization, blood gases, cannulation, intramuscular injection, etc. Now, previous curriculum, the GMC put those core procedures into the F1 curriculum. They are no longer in the F1 curriculum, and they are part of outcomes for graduates that the GMC expect. They expect doctors to be able to do that as they're coming in to F1 rather than the end of F1. However, we know that many of our foundation year 1 doctors come from a range of backgrounds and a range of medical schools, and some of those medical schools don't actually train on those procedures. So some people might come without actually being able to cannulate or to put in a urinary catheter, and therefore if you haven't done this at undergraduate, then this is where you can demonstrate in your portfolio that you can actually do them. So if you have come to foundation without those competencies, this is where you can put them in. They don't count for your SLEs. So the SLEs can be the direct observation procedures, the mini KEXs and the CPDs. These are different. And for the vast majority of you, if you feel you came through a medical school that taught you how to do this, you don't need to put them in at F1. But if you feel that you didn't come with them, and your supervisor might say, you didn't come with those skills, let's just get them in your portfolio now to show that you have those. So that it won't apply to all of you. If you want to fill them in, you can, but you don't have to.
Thanks, Fiona. There's a question. Well, I'll answer the next question. It's about less than full-time trainees. Less than full-time trainees. There's a pro rata requirement for the year, and so it's 20 days over 2 years if you're working at 50%. And if you go part-time during the year, your completion date should be recalculated. You will still have an ARCP in June, but it might just say this person, or it will come to the conclusion this person is a part-time trainee, and there will be a further ARCP on this date, and that's the date that you may go through. If you've already been through that process and are working out of phase, it may be that you won't get an ARCP in June. But if you're an F1 and it's your first time to come through to an ARCP, you will definitely get one. time out of training is counted the same. There was a question, I think, oh yes, I was just talking about the core hours of teaching. Yeah, if your rota means you can't get to them either, again, as long as you've made up with other teaching sessions that are relevant to the core teaching, I think most ARCP panels, well, in fact all ARCP panels should let you through. There's also a question about local requirements. I think the requirements for ARCP are in that slide that Fiona put up. They are on page, I think it's 77 of the curriculum, and it's very clear what you need. And if your local foundation school or your local trust says, we'd like you to have this as evidence for this, then that's a very good shorthand way of providing that evidence. If you choose not to or can't provide that evidence, then you need to provide something equal. But you shouldn't really, and I don't think, to be fair, she should have been given an outcome 5, as long as she had provided evidence that she had done the QI requirement. While I'm on QI, I will just mention there are very clear QI requirements. At F1, you're supposed to have some involvement with the process, so if you haven't finished your audit by ARCP, it doesn't matter as long as you've been involved. F2, you should have more of a significant involvement. You should have been more actively involved in a project. Hopefully you should have finished it. Ideally, you should be looking at re-auditing or reviewing the process, or perhaps having done some sort of rapid review, so that you're moving things forward as you go through. And part of this is for your ARCP requirement. You don't have to do a full round of audit, though it would be good. But bearing in mind that foundation is a basis for future training, and particularly for applications for specialty training, if you're going into particularly hospital specialties, then evidence that you've done an audit will look good in your portfolio and will give you a mark when you apply for specialty training. So I think that's an important one. I'm just having a look through some of these other questions here. I don't know, Aisha, I haven't called you in yet. Is there anything you wanted to add in from what you've seen so far?
Not that I could see.
Okay. Well, while you're thinking, we're back to the evidence thing again. You need appropriate evidence. If you haven't got a certificate from being on your simulation day, then write a reflection on it. And if they particularly want to check, they can look up the attendance record and make sure you were there. But it's all about learning, really. So evidence of what you gain from it, what you learned. ALS is not a specific requirement, but it's a very easy way to demonstrate most of FPC2. And when we say evidence, do we mean SLEs? Yeah, well, as Fiona said, SLEs in the workplace is a demonstration that you're actually doing the job properly. And if somebody's done an SLE and you're doing the job properly, then you're going to pass. And that's the best form of evidence. If you can't get an SLE for everything, then evidence of reflection or evidence of other things that you've done may be helpful. You'll definitely need some SLEs in HLO1 or FPCs 1 to 5, because that's the nature of those kind of things. You need to demonstrate that you can do the clinical stuff. As Fiona said, if you're trying to demonstrate you're working in a team, then your tab is probably the best thing to put it in. That may be all you need for evidence of working in a team. Developing the clinical teacher might be all you need for evidence in FBC 10 for the teaching. You may not necessarily need numbers, but you might want to put more in for FBC 2 or FBC 4 to show evidence that you're working well clinically. Yes, sick days are included in the 20 days. Can you map end of placement meetings? Yes, end of placement meetings, definitely. If your supervisor has written in your clinical supervisor's report saying, yeah, I've worked with this trainee, they're great, they understand their clinical work, I've seen them do, I've seen them look after a sick patient, they're very capable, then that's absolutely excellent evidence for whichever SLE you choose to you choose to use it for. Fiona, Aisha, anything you want to chip in while I just look through any other, see if there's anything else?
Yeah, there's a question there, Tony, about please could you explain further about what's required for social and mental health evidence?
Oh yes,
So
I was
yes,
asking.
yeah.
Yeah.
So if you're thinking this should really be evidenced by SLEs, and I know that all of you who are working in medicine will always be thinking about the patient holistically. So let's think about a 55-year-old man who breaks his femur when he is self-employed as a joiner, okay? So he may have a background history of anxiety or depression. So he comes in, he breaks his femur. He is now off work for a period of 2 to 3 months. He already has a background of depression, anxiety. You could write an SLE saying, I admitted this person, he had a wire down his femur. However, the main aspects of his care were relating to his mental health. This obviously had a significant impact on his ability to work. He's self-employed. How is he going to manage? Can he get home? Or maybe you've got an elderly person who can't get home because they were living at home by themselves, but something happened to them. They then have to go into care homes. What's going to happen to them? What's the package of care? It is mental health, it is social health, it is people's lives. And I know that all of you, because all of us as doctors, when we see somebody with something physical wrong with them, we know that that's a person in there as well. It's going to impact on their mental health. It's going to impact on their lifestyle, maybe their employment, their finances, all sorts of things. And I know that you all do that. It's just actually capturing that and putting it down in your SLEs. And I bet you, those of you who've been working clinically today or yesterday, you will have seen patients and similar to that in all your specialties, and I'm sure you can think of something. So that's what we're looking for. We're not looking for that you actually have to have seen somebody with a complex personality disorder or schizophrenia or something. You may not do a psychiatry job, and if you don't have a psychiatry job, I bet you will still see patients who have got mental health problems, who may not have something and then develop a mental health problem because of what's happened to them. And any illness infects our social environment, doesn't it, with our pay issues, our isolation from our friends and our family and our colleagues, and the impact. That's what we're looking for. It's just so that you think of the patient holistically and not just as a fractured neck or femur. Okay, so that's what we're looking for.
Thanks, Fiona. There's a couple more questions on QI that I perhaps need to cover a little bit more. F1, as I say, this will be some involvement in QIs. You don't have to do a QI project. There's one way you could do it, but if you're not involved in a QI project, you need to provide some evidence that you're involved in QI. So that might be attending your departmental audit meeting and contributing to it, perhaps reflecting on it. It might be becoming involved in somebody else's project to provide some support, but you do really need to provide some evidence that you're involved in quality improvement. That doesn't have to be an audit, it can be any of the other quality improvement things. It could probably be case reviews and this kind of thing as well. So anything that helps develop your service. There's one or two questions about PSG and TAB. TAB is what you ask for, and is largely around team working, and it's evidence of your team working. PSG, your supervisor asks for, and there's no very clear guide on it. We tend to be relatively flexible, but we would probably expect one of the other contributors to be either a senior GP or a GP in the practice, or a supervisor or other consultant. It might be a registrar, there might be nurses, there might be specialist nurses, it might be the pharmacist. So a variety of different people can contribute to that. So I think we've probably covered most here, unless there's some new ones to come in. I think we'll probably stop accepting questions. Yeah, there's a question about local requirements for ARCP. You should be told what people want if they want specific things, but as I say, those aren't UKFPO requirements. Publishing primary research counters quality improvement? No, it doesn't. We're looking for evidence of quality improvement and trying to develop the service. Locum days, offset 6 strike days. You'd have to discuss that with your local supervisor, but if it came down to you're on 21 days and you've done a couple of locum shifts, then I dare say they would probably accept that as evidence that you've done it. Do we need to have a leader form? Doesn't have to be a leader form, but that was put in there because many supervisors aren't that experienced in dealing with how people provide evidence of leadership. So the form is there with very clear things to look for. When we started the foundation program, DOPS, for example, had a list of all the things you should do in terms of explaining the procedure to the patient, taking informed consent, using a sterile field, preparing yourself up, working your way through the procedure, clearing up afterwards, and so on. But I think we all know what a DOPS involves now, so they're slightly more open fields. The leadership, we're possibly not quite there yet. As I say, many supervisors aren't that clear. So the leader is quite a good way of demonstrating that you've done some leadership stuff. If you want to put something in your portfolio that shows you can do leadership stuff for your specialty application, it's probably quite a good way of doing that to ensure you get some structured feedback and something you might want to show at your interview. But you don't have to use a leader form. You don't have to use any of the forms particularly. You probably advise to use some SLE forms for HLO1, but otherwise, it's up to your discretion really which forms you use. The learn form is there. It's a very open form. You can use that for pretty much anything. So I'm hoping that will be helpful. Yeah, I think
just another question there, Tony, about courses. I don't know what a max course is, but courses don't count for teaching, for learning. So there are exclusions on the website as to what's included and what's excluded. Yeah, courses we exclude.
Okay, so I think we're coming to the end of our time. I'd like to say thank you to our attendees. We were up to getting on for 200 at one stage, which is great attendance. It shows there's a lot of interest in this. I would like to wish you all the best of luck with your ARCPs. I'm hoping none of you will need it. You should all be there and evidence with your portfolio, but I hope you get the outcome you expect. And I hope you found this webinar useful. I'd particularly like to thank Fiona and Aisha for their presentations, which I think were both incredibly useful. And you may not know, but Kieran and James from the UKFP have been working away in the background, sorting out technical glitches, reviewing questions, publishing things, and this wouldn't have been possible without them. So thank you very much indeed. This webinar, as I say, will be on the website in a few weeks. If anybody needs to review it, you can share it with your friends and colleagues. And if you've missed previous webinars, they're also on the website. The last one was about careers and was very useful. For those interested in QI, we had a session earlier this year on quality improvement or sustainability within quality improvement, which was a really interesting session. And I'd certainly commend that to you. So I think, yeah, either of those would probably count as an hour's non-core teaching. Anyway, thank you all very much, and I look forward to seeing everybody again next month.